There's a 9-digit number in your wallet right now that you've probably never thought twice about. Little card, tucked behind your driver's license. You've used it to open a bank account, get a job, file your taxes, and you've probably never once asked where it came from or what it took to get it there. Here's the thing. For over 150 years of American history, if you got old, if your body just gave out, if you couldn't work anymore, there was no check coming. None. Not one. No government program. No safety net. Nothing. So what happened when you turned 68 and your hands wouldn't hold a hammer anymore? What happened when your children had 6 mouths of their own to feed and couldn't take you in? What happened when the only roof left over your head belonged to the county, a place built for paupers, for the insane, for anyone the town didn't know what else to do with? This is a story about a traveling doctor with a $200 a month idea that terrified the White House. About a movement of old people who organized by the millions, almost overnight. About a woman in a cabinet meeting, fighting to be taken seriously in a room full of men who didn't want her there. About another woman, named Ida, who cashed the very first check the federal government ever wrote for growing old. And about a law that quietly left millions of black workers out in the cold, even as it promised to catch everyone else. This is the story of how America decided, for the first time, that getting old shouldn't mean falling off a cliff. And it's the story of who got left standing at the edge anyway. Let's back up to the start. Picture a woman in her 70s, around 1910. Widow. Her husband's been dead a decade, her kids have their own struggles, and her body just doesn't do what it used to. She can't farm anymore. Can't take in laundry, not with her hands the way they are. She has, by any modern definition, nothing. What happens to her? If she's lucky, family takes her in. A daughter, a nephew, somebody with a spare room and enough food to stretch. But if she's not lucky, and a lot of people weren't, there was exactly one institution built to catch her. The poorhouse, sometimes called the almshouse, sometimes the county farm, depending on where you lived, and depending on where you lived, the name changed, but the reality mostly didn't. And here's what almost nobody remembers about these places. They weren't just for old people. They were for everyone society didn't have another box to put you in. The elderly poor, sure, but also the mentally ill, the physically disabled, orphans, alcoholics, unmarried mothers, people with no family left at all, housed together, often in the same building, sometimes the same room. A 70-year-old widow might spend her last years sleeping in a dormitory next to a 19-year-old with a severe mental illness. Both of them there for the same basic reason. The country had nowhere else to send them. Conditions varied wildly, depending on the county and how much money it was willing to spend. Some almshouses were reasonably clean, reasonably humane, run by people who genuinely tried. A lot weren't. Investigations into poorhouse conditions, conducted state by state over the decades, kept turning up the same complaints. Overcrowding, inadequate food, minimal medical care, almost no oversight from anyone above the local level. And these weren't rare, isolated institutions, either. By the early 20th century, there were thousands of them scattered across the country, one in nearly every county, quietly absorbing the people the rest of the economy had no use for anymore. The general shape of the system was the same everywhere. You went in when you had nowhere else, and for a lot of elderly Americans, you didn't come back out. You died there. Government surveys from the era found that a significant share of almshouse residents nationally were elderly, and for many of them, Admission wasn't a stopgap. It was the last address they'd ever have. Sit with that for a second. Growing old in America, for most of its history, carried a real risk of ending your life in an institution built for society's overflow. Not because you'd done anything wrong, not because you'd been lazy or reckless or foolish with money, just because you'd lived long enough to stop being able to work in a country that hadn't yet decided that mattered. But even the poorhouse couldn't hold everyone who needed it. Because for most of American history, old age insurance had a name, and it wasn't a government program. It was children. The whole system, if you can even call it a system, ran on the assumption that families stayed together. You had kids, raised them on the farm, and when you got too old to work the land yourself, they took over and you stayed put. 3 generations, 1 household, 1 roof. Nobody signed a contract for this. Nobody called it a retirement plan. It's just how things worked, going back further than anyone could remember, baked so deep into the culture that it barely needed explaining. And then, over about 50 years, it stopped working. Industrialization pulled young people off the farms and into cities. Factories, offices, a completely different kind of life, with completely different economics. That's not inherently a bad thing. People wanted better wages, more opportunity, and cities offered both, often for good reason. But something got left behind. Literally. Aging parents, still on the family farm or in the old hometown, with grown children now 300 miles away in Chicago or Detroit. Working shifts that didn't allow for more than a visit home once or twice a year, if that. By 1900, roughly 40% of Americans lived in cities. By 1920, for the first time in the nation's history, more Americans lived in urban areas than rural ones. Verify. Precise urban-rural population. Crossover figures. 1900-1920 census. That's not just a demographic curiosity. That's millions of family safety nets, quietly stretched past the point where they could actually catch anybody. The old system assumed proximity. The new economy destroyed it, 1 train ticket to the city at a time. By the 1920s, you had a growing population of elderly Americans who were, for the first time in the country's history, cut off, geographically, economically, from the family support that used to catch them automatically. No pension, unless you'd worked for one of the small number of large employers or unions that offered one, and even those were often unreliable, underfunded, or contingent on decades of continuous service nobody could guarantee. No savings, in most cases, because wages were low enough that saving for old age was a luxury a lot of working families simply couldn't afford, even if they'd wanted to. Just distance and hope. Then the whole economy fell out from under everyone at once. Now, some elderly Americans in the 1920s had done everything right. Worked their whole lives, lived frugally, put a little money away in a local bank, year after year, exactly the way you're supposed to. They weren't relying on children who'd moved to the city. They weren't counting on the poorhouse. They had savings. They had a plan. They'd done the responsible thing. And they'd earned, or so they thought, some kind of security because of it. Then October 1929 happened. You know the headline version. Stock market crashes, Great Depression begins. What gets skipped over, usually, is what happened to ordinary bank accounts that had nothing to do with Wall Street at all. Between 1930 and 1933, thousands of banks failed across the country. Not a handful. Thousands. Small-town banks. Regional banks. Banks that had never touched a speculative stock in their existence, brought down anyway by panic, by bank runs, by a financial system with almost no structural protection built into it. And when a bank failed back then, there was no federal insurance underneath it. Nothing to stop your life savings from simply vanishing along with the institution that held them. So imagine you're 65 in 1932. You did the responsible thing your whole life. And in a single afternoon, a bank closing its doors, a line of panicked depositors outside who got there too late, a hand-lettered sign in the window. Every dollar you saved for exactly this moment is just gone. Not invested badly, not spent foolishly. Gone because the building holding it collapsed, and nobody was coming to make it right. And it wasn't only the elderly who got hit. Their children got hit too. Unemployment climbed toward a quarter of the entire American workforce by 1933, which meant the informal safety net, "My kids will take care of me," was collapsing at the exact same moment the formal one, the savings, the banks, was collapsing right alongside it. Both pillars, gone in the same few years. A son who might have taken in his aging mother in 1925 might, by 1932, be out of work himself, unable to feed his own children, let alone anyone else's dependents. For the first time, this wasn't a problem confined to the unlucky or the careless. It was happening to everyone, all at once, regardless of how responsible you'd been, regardless of how hard you'd worked, or how carefully you'd planned. And when a crisis stops looking like an individual failure and starts looking like it could happen to anybody, that's usually when people stop asking, "What did they do wrong?" and start asking, "What do we do now?" Into that panic walked a small-town doctor with a very big idea. His name was Francis Townsend, a doctor in his late 60s himself, living in Long Beach, California. He'd spent much of his career as a country physician before eventually taking a position with the local public health department. And by 1933, he'd lost even that, a small public health post, cut in a round of Depression-era budget cuts, one more casualty of an economy that had stopped finding room for its older workers. So here's a man who's spent decades treating patients, who understands better than almost anyone what poverty does to an aging body, what it does when arthritis sets in and there's no money for a doctor, when malnutrition creeps in slowly enough that nobody quite calls it starvation. And now he's one of the very people he used to worry about. One day, looking out the window of his modest home, he saw 3 elderly women digging through garbage cans behind his house, looking for food. That image apparently never left him. So he did something about it. Sat down, worked out a plan. And it was, by the standards of the time, almost absurdly simple. Every American over 60, he proposed, should get $200 a month from the federal government. No means test, no complicated formula, no bureaucracy deciding who deserved it more than someone else. $200 a month, which in 1933 was more than a lot of working adults were earning in a full-time job. The only real condition, you had to retire, freeing up your job for someone younger who actually needed the work, and you had to spend the whole $200 within 30 days. No saving it. Spend it. Let it circulate back into local businesses. And, in Townsend's theory, at least, pull the whole economy up along with it. He funded it, on paper, with a national sales tax, a flat 2% on transactions across the country. Economists at the time had real doubts about whether the math actually worked, whether a sales tax at that rate could plausibly cover payments of that size to every American over 60. And honestly, looking back with the benefit of nearly a century of hindsight, most economists still think the numbers didn't add up. But here's the thing about the Townsend Plan. It didn't need to be perfect. It needed to be simple enough for a frightened, exhausted country to understand in a single sentence, repeated at a kitchen table or shouted from a soapbox, and it was. Townsend published the idea in a letter to a local newspaper in September 1933, and it caught on faster than almost anyone, including Townsend himself, expected. Within about 2 years, Townsend clubs had sprung up in nearly every state. By some estimates, over 2 million members nationwide, organized into thousands of local chapters. Verify exact peak membership and chapter count for Townsend clubs. These weren't just mailing lists, they were real, functioning social organizations. Elderly Americans who'd felt invisible for a decade or more, who'd spent years being quietly told to accept the poorhouse or the goodwill of relatives as their only options, were suddenly organizing with real energy and real structure. Meeting in church basements and union halls week after week. Publishing their own newspaper, with circulation in the hundreds of thousands. Writing letters to Congress by the truckload. Historians describe congressional offices genuinely overwhelmed by the volume of Townsend Plan mail arriving in 1935, showing up to rallies in numbers nobody in Washington had anticipated from a demographic most politicians had never bothered organizing before. And Washington noticed. This wasn't a fringe curiosity anymore. It was a political force with millions of members and a genuine grassroots infrastructure, and a president facing re-election in 1936 who could not afford to have that force organized against him. FDR's administration didn't need to agree with Townsend's math to understand the pressure it represented. Either the federal government came up with its own answer to old-age poverty, one that was more fiscally credible, but still met the moment, or an increasingly organized movement was going to force something on it regardless, on terms Roosevelt didn't get to choose. The White House couldn't ignore it, so it built something to compete with it. FDR's answer had a face, and it wasn't his own. It belonged to Frances Perkins, his Secretary of Labor, the first woman ever to hold a cabinet position in the United States government. And by 1934, the person tasked with turning "we need to do something about old age" into an actual, workable federal law. Perkins wasn't new to this fight, and she wasn't in that room by accident. She'd spent decades in labor reform, going back to before she ever set foot in Washington. She'd witnessed the Triangle Shirtwaist Factory fire in New York in 1911 firsthand, stood on the street, and watched workers jump from the windows of a burning building because the exits had been locked to prevent unauthorized breaks, and it shaped, permanently, how she thought about what government owed the people it governed. When Roosevelt offered her the labor secretary position in 1933, she reportedly told him she'd only take the job if he backed a genuinely ambitious agenda, including unemployment insurance and old-age security. So when FDR handed her the job of designing a national response to old-age poverty a year later, this wasn't an abstract policy exercise for her. It was the culmination of a career she'd been building toward for over 2 decades. In 1934, FDR created the Committee on Economic Security, with Perkins chairing it, and gave it a mandate to design a comprehensive answer: old age insurance, unemployment insurance, aid to dependent families, several pieces at once. The committee's staff studied existing models from Europe, where several countries already had some version of state-run old age insurance running for years. They studied the handful of American states, Wisconsin most notably, that had experimented with unemployment insurance on a smaller scale, and they argued, extensively and often heatedly, over the basic architecture. Should this be funded like Townsend's plan, out of general tax revenue, or should it work more like an insurance system, funded by contributions from the workers who'd eventually collect it? Perkins and most of the committee landed firmly on the insurance model, and the reasoning mattered. A program funded by dedicated payroll contributions, they argued, would feel to the American public less like a handout and more like something workers had earned and paid into themselves. Politically more durable in the long run, than a benefit that depended on Congress renewing general tax funding every year. Where Townsend proposed a flat, universal payout funded by a sales tax everyone paid at the register, Perkins's committee proposed something closer to an insurance system. Workers would pay in through a payroll tax deducted directly from their wages, the thing you now know as FICA, with employers matching the contribution dollar for dollar. The money wouldn't go out to everyone equally. It would come back to you later, roughly scaled to what you'd paid in while working. Slower to start, more bureaucratically complex, nowhere near as immediately generous as Townsend's $200 a month, but built deliberately to last decades, not just to win one election cycle. That was the vision, anyway. Getting the actual bill through Congress meant compromise, plenty of it, and some of those compromises still shape the program today. Benefits wouldn't start immediately. They'd phase in over years, with the first payroll taxes collected starting in 1937 and the first monthly checks not going out until 1940. That timeline alone drew criticism from Townsend supporters, who pointed out, correctly, that plenty of elderly Americans suffering right now wouldn't live to see a single dollar of it. And to secure enough votes, particularly from powerful Southern Democrats who support the bill needed to pass at all, certain categories of workers got carved out of the law entirely, a decision that would echo for decades. But not everyone was invited into this new safety net. Here's the part of the story a lot of retellings skip entirely. And it matters because it shapes who this safety net actually caught and who it let fall straight through. The original 1935 law excluded two entire categories of workers from coverage: agricultural laborers and domestic workers, maids, cooks, nannies, farmhands, the people who worked the land and ran the households of other Americans. On paper, that sounds like a narrow administrative carve-out, maybe a matter of how difficult those jobs were to track for payroll tax purposes. In practice, it was enormous. Those two job categories happened to be where a huge share of black workers in America were employed, particularly across the South, where the overwhelming majority of the country's black population still lived in 1935. Was this an accident of bureaucratic line drawing? Historians have looked hard at that question for decades, combing through committee records, floor debates, and private correspondence from the period, and the honest answer is probably not entirely. Southern Democrats controlled a significant block of votes the bill needed to pass, chairing key committees in both the House and Senate, and there's substantial historical evidence that excluding these occupations was, at least in part, a deliberate concession to secure their support, a way of designing a program that could be marketed nationally as universal, while quietly ensuring it wouldn't extend full economic protection and the political and economic leverage that came with it to black agricultural and domestic workers in the South. Verify specific archival evidence and historian consensus on the degree of explicit legislative intent behind the exclusions. The effect was straightforward and brutal in its simplicity. Millions of black Americans, along with plenty of white agricultural and domestic workers too, since the exclusion wasn't written explicitly by race, just effectively sorted by it, paid no payroll tax into the system because under the letter of the law, they legally couldn't participate. Which meant, decades later, when they reached old age, there was no benefit waiting for them. The same law being celebrated in the urban North as the end of elderly poverty was, for a huge share of the black working population, particularly in the rural South, functionally invisible, the poorhouse, or the family, or nothing. Same as before 1935. Because the new federal safety net simply didn't apply to the job you happened to hold. And, for a lot of black Americans in 1935, the jobs available to them were, not coincidentally, exactly the ones excluded. It would take decades, amendments in 1950, and further expansions after that, before those occupations were gradually folded into coverage, giving domestic and agricultural workers the same access to benefits as everyone else. That took real, sustained political effort, spread out over years and multiple Congresses, while in the meantime, an entire generation aged into retirement under a program that, as originally written, simply wasn't built with them in mind. It's worth sitting with that, because it complicates the tidy version of this story that gets told most often. Social Security is rightly remembered as a landmark, one of the defining achievements of the New Deal. It's less often remembered as a landmark with a footnote, one where the fine print quietly decided who actually got caught by the net and who didn't, and where that decision tracked awfully closely with race and region. Even so, on August 14, 1935, the president picked up his pen. FDR signed the Social Security Act into law that day, in the cabinet room of the White House, surrounded by the people who'd fought hardest to get it there. Perkins included, standing near the desk after 2 years of committee meetings, congressional testimony, and constant negotiation. But signing a law and actually putting money in someone's hands are two very different things, and the gap between them, here, was 5 years. The payroll tax didn't start being collected until January 1937. The Social Security Board, the new federal agency created to administer the whole system, had to build an entirely new piece of government infrastructure essentially from scratch, issuing millions of Social Security numbers to workers who'd never had anything like it before, setting up record-keeping systems in an era with no computers, just paper ledgers and index cards, tracking contributions for tens of millions of Americans across thousands of employers. And the first monthly retirement checks, the thing the whole program was actually built to deliver, didn't go out until January 1940. 5 years between "this is now law" and "this actually helps anybody currently alive and old." For a lot of the elderly Americans who'd cheered loudest back in 1935, who'd written those letters and joined those Townsend clubs, that wait meant the program came too late to change their own lives at all. But on January 31, 1940, in Rutland, Vermont, a woman named Ida Mae Fuller opened a very ordinary-looking government envelope. Inside it was a check, $22.54. Fuller had worked for decades as a legal secretary, paid into the new system for exactly 3 years before retiring, and by pure administrative circumstance, she happened to be one of the very first people to file a claim once benefits opened up. She ended up as the first person in American history to receive a regular monthly Social Security retirement check, rather than the lump sum payments a small number of very early retirees had gotten before the monthly system fully kicked in. $22.54. Not a lot of money, even by 1940 standards, when a loaf of bread cost a few cents, and a month's rent in a small town might run you $15 or $20. Nowhere near life-changing in the way Townsend's $200 would have been. But it was the first one. The first time in American history, the federal government sent a retired citizen a monthly check, funded by money she'd paid in over years of honest work, purely because she'd gotten old and earned, through decades of contribution, the right to stop. Ida Fuller lived to be 100 years old. She kept cashing that check, adjusted upward many times over the decades as the program grew and inflation pushed benefits higher, for 35 years straight, collecting, in total, far more than she'd ever paid into the system, which is, in its own small way, the entire promise of Social Security in miniature. Pay in what you can while you're able, and the country catches you on the other side, for as long as you need it, however long that turns out to be. That check was the beginning. But the story didn't end there. Because this was never really just about money. Not at its core. It was about a question America had never formally answered before 1935. Is growing old and running out of the ability to work a personal failure? Something you should have planned better for, saved harder for, worked longer for? Or is it a shared risk, the kind a whole country agrees to carry together, the way it insures against fire or flood? For 150 years, the unspoken answer had been the first one. The poorhouse said so. The empty savings account, wiped out overnight by a bank collapse nobody saw coming, said so too. Social Security was the first time the federal government said, officially, on paper, backed by a payroll tax and a federal agency, the second one. And that question hasn't gone away. It's just changed shape. Today, Social Security keeps a huge share of Americans over 65 out of poverty. A number worth looking up for yourself, because it shifts almost every year with new census and Social Security Administration data, and it's also at the center of an ongoing fight over solvency. How long the trust fund lasts under current projections. Whether the payroll tax cap, the point at which high earners stop paying in, should rise. Whether benefits get trimmed, or the retirement age gets pushed back again, the way it already has been once before. The specific figures shift with every new government report. The underlying argument, who deserves protection, who pays for it, and how much of it is a country's job to guarantee versus an individual's job to earn, is the exact same argument Francis Perkins and Francis Townsend were having back in 1934, just with updated numbers. And underneath the modern debate is that same 1935 footnote too, still working its way through history. The reminder that a program built to protect everyone can still, through the fine print, quietly exclude the people who need it most, and that fixing that kind of gap usually takes decades, not a single bill signing. So next time you glance at that FICA line on a paycheck, or that 9-digit number tucked in your wallet, it's worth remembering. It wasn't always there. Somebody had to fight for it. A doctor who saw women in a garbage can. A labor secretary who watched people jump from a burning building. An elderly woman in Vermont who cashed a $22 check and lived to be 100. And whether it was worth what it cost, and who it still leaves out, that's still being decided right now. One budget debate at a time. Because the systems you never think about are usually the ones holding everything up.